Health officials are warning the public about two new strains of COVID that are going around this summer. The new variants are called Nimbus and Stratus. Joining us now with what you need to know is Dr. Ulysses Wu, Chief Epidemiologist of Hartford Healthcare. Dr. Wu, it's great to have you today.
Thank you for having me again.
So first, can you tell us about the variant called Nimbus? What are the symptoms and how is that strain different?
Sure, I'll actually make it a lot easier. Nimbus and Stratus, the symptoms are actually going to be very similar and very similar to the previous COVID strains. They've just been given names. And so there are variants popping up all the time since COVID arrived on our shores back in 2020. I think what is being circulated is that there may be a razor blade, sore throat type symptoms, or the raspy voice with Nimbus, like the smoker's voice, or what I like to say, the Demi Moore voice. And so the thing is, with the previous variants, sore throat was one of those things that we always looked for. Raspy voice, not so much, but you can get that with a lot of other diseases besides COVID, including other respiratory infections, allergies as well. And so I don't want to confuse the public because the symptoms they should be looking for should be fairly the same.
All right, so just walk us through those symptoms once again. Important reminders, in addition to that razor sore throat you were telling us about.
Yeah, besides sore throat, besides this raspy voice, it sometimes starts as an upper respiratory infection. You can have congestion, you can have runny nose, your sinuses could feel full, but you can also have lower respiratory tract infections such as cough, pneumonias. You also may just feel systemically ill, and so you may not have any focal signs or symptoms that localize to any part of your body. So you may have fevers, what we call body aches or myalgias. You may have joint pain or arthralgias. Rash may be associated with it. You may even have GI symptoms, nausea, vomiting, some diarrhea associated with it. Headache would be the other. And then malaise, what we call just feeling lousy in general. These are all symptoms that would be associated with COVID and unfortunately other respiratory illnesses as well.
Are there many cases in Connecticut of these two variants right now? Do you know that?
It's difficult to say right now, but Nimbus is almost likely within Connecticut. And within Connecticut, we've always had a late summer surge. So we're not quite in the late summer. I don't want to bum anybody out saying that the summer's almost over, but we've always had a summer surge, typically later. I don't know if this is going to be responsible for that or another variant or not having a summer surge at all.
Couple more seconds here. What can we do to protect ourselves?
Same things I'm always saying. If you're sick, try not to get anybody else sick. Vaccines will help you, especially if underlying conditions. Masking, people don't like it, but if you're sick, it will protect you and help protect others.
All right, Dr. Ulysses Wu, always great information, Chief Epidemiologist of Hartford Healthcare. Great to see you.
Thank you for having me again.
All right, take care.